And good morning. My name is Harlon Pickett. I will be your host for the Kickstart. This is a reimagined version of what we started last year whenever we bring industry updates and news to you each and every week to help you stay current with what's going on. Whether you're in the industry or not, we know it's very impactful and important to know what's going on around you, what's happening in the health insurance and healthcare worlds. And we are going to provide that update for you on a weekly basis. We'll get started in about 30 seconds as everyone comes in. Appreciate you being here today. All right, and welcome again to the Kickstart. I am Harlon Pickett. Thank you so much for being with us today. We are across multiple platforms trying out some new technology in this reimagined version of the Kickstart. Hope that you enjoy the episode today with the information we're going to provide you. If you don't know who I am a longtime industry expert that has really become more of an advocate now. And I really understand a lot of the things that are wrong with our healthcare system and working diligently to put together a separate healthcare system, along with many other forward thinking advisors and folks that are in our industry, so that we can really have access to healthcare. That's just the touch of kind of what I am all about. If you want to learn more about me, please connect with me on LinkedIn. I do quite a number of events to really show what we're all about. Now, as we go through this, we're going to talk about a number of the stories that are going on in our industry right now, but we want you to participate. Don't forget that you can type in your questions or your comments in the chat. Those will be presented later on in the episode as we can answer any questions or really look at any comments that you may have. We certainly appreciate you being here today. We know that you have lots of things you could be doing right now, but we appreciate you being here right now. All right. So we're going to kick it off with really the biggest thing that's going on over the last 2 weeks. This has been the story that has affected the healthcare industry the most anything has in a long time. And that is the data breach at Change Healthcare. This has had a dramatic impact across the entire healthcare world. Now, if you're thinking it just affected, say, hospitals, maybe affected some of the bigger groups here or there, that is absolutely, it's true, but that's absolutely not true that it's the only ones that it affected. The small folks, it is just absolutely almost destroyed a lot of small physician offices, whether they're and clinicians across the board, really, whether they're physical therapists or whether they are, primary care doctors, even specialists. And of course, it had a lot of impact on pharmacies too. So folks had a really difficult time getting their prescriptions. When you cannot have the transfer of data, wow, it makes a huge difference. It's amazing how much Change had their fingers kind of into everything, and it's had a dramatic effect on the entire U.S. healthcare system. Now, there have been some fixes put in place, I guess is the best way to say it. As of March 1st, one of the fixes is for pharmacies. They can now do some e-prescribing, and that is going to help them really get some confirmation of certain prescriptions that are eligible to be paid for. That because it's not just about the payment, it's also the eligibility. One of the issues is it was very difficult in many cases for people to show that they had they even had insurance. So physicians, even hospitals, they could not verify benefits. Another couple of things that are happening kind of behind the scenes is there is payments. So they have some payment kind of workarounds right now where they're trying to make sure people get payment whenever they're kind of behind, as it were. I talked to a physician late last week, and he said they were recommending to them, and they were at that time submitting paper claims. Now, there's a lot of bad things with paper claims. And number one is it takes about 93 days, 93 days from the submission of a paper claim for you to get paid. And then, of course, there's also a greater chance that there is going to be an error in that claim. So if there's an error in that submittal, then it's just start over again. And so once again, your 93 days is going to start over again. So there's a lot going on with the data breach. Most experts out there say this could be a very long-term situation before it is all cleared up. And this is just the impact. So imagine this is just the impact of what is happening on the healthcare system. We still don't know 100% what kind of data that they received. So the data breach means that they've just stopped. The flow of information has stopped because they just kind of had to shut everything down. But what information of the individuals that they're in that system, and we're talking about hundreds of millions of Americans that potentially will have their medical records and other data about themselves, of course, that are now in the hands of some bad guys, right? Some folks that you certainly don't want to have that data, some bad actors. So we don't even know what that looks like at this point in time. We just know the impact of what it's having on the healthcare system, and it's not good at this point. Although there are some slight fixes coming along, what it's going to look like long term could put some serious damage to especially some of the small practices out there. All right, next we are going to talk about Congress failing again, the government failing again on a major reform that needs to happen. I believe that it's very interesting to me that time and time again, the government has an opportunity to do something that will have a positive impact on the cost of healthcare, and they seem to fail every single time. Now, this one was a bit surprising to a number of people because it actually had a lot of there was a lot of support from both sides. There was support from both sides of the aisle. Typically, if you're only going to have support from one side, it's just not going to work out unless there's a huge majority there. We certainly don't have that in Congress and the White House right now. So because we don't have that, you would think, okay, if they can agree on something, this is a no-brainer. And everyone hates the PBMs right now, right? Yeah, not so much. Well, follow the money. I mean, the bottom line is here, I'll say follow the money, because there is so much funds out there that prop this stuff up. It's hard to get anything done. So even when there was so much support from both sides of the aisle here, at the end of the day, it's just something that has been stripped away from the funding bill. Didn't even get a bill of its own at this case. They're just trying to lump it in with other stuff. And then there's always the things that are going to get cut. And it looks like most of the major things that we were hoping for on the healthcare side are what's taking the hit right now, including any change to PBM reform. That's good news for those bad guys, those bad actors, as it were. But here's the bottom line once again on this. There are lots of good PBMs out there. There are lots of good folks out there that have already got this solved. So if you're waiting for the government to fix something, you need to just stop. Just know that that's not going to happen anytime soon. But there are already solutions out there that do things the right way, very transparent, fiduciary PBMs that are out there ready to help you in your health plan and help your company right now. So you don't have to wait for the government to fix something that's already fixed by a number of companies. The big guys are going to keep on doing the bad things, but in this case, that's what's going to happen, folks. So just know there are really, really good PBMs out there. If you want to know more about that, hey, reach out to me. Once again, you can find me on LinkedIn. You can email me at hpickett@eaglecarehealth.com. I'll be happy to connect you with some of our partners that we've worked with that have done a great job in providing excellent services and full transparency. All right. Shocking, right? Employers to expect higher healthcare costs in 2024. Wow, who would have thought it? They're looking at really the trend right now is going higher than even the inflation. So we're talking about an average of about a 7% trend for the rising cost of healthcare. What that is going to do, once again, is put employers behind the 8 ball. So we're going to talk about a survey that was done by the National Alliance of Healthcare Purchaser Coalitions. And, great response from this, by the way. 172 responses were received from private and public employers. They varied in sizes from well under 1,000 to well over 5,000 across many industries, federal, state, government, education, healthcare, retail, finance. So across a whole bunch of different type of industries and size groups. And this very first stat is just hilarious to me, because when have you ever seen 172 of anything ever agree on one particular thing? Well, that's exactly what's happened. So one of the key findings was that 100% of employers agree that attracting and retaining talent is a top priority, but the rising cost of healthcare costs proved to be a significant challenge. Now, I laugh at that because it's 100%, but it is a pretty strong statement, right? I mean, we know that the rising costs are going to impact any kind of, it's going to have a challenge. And so the fact that 100% said that is surprising and not surprising, because it's hard to imagine 172 people agreeing on anything. But another side of that was 81% of those actually strongly agreed with that. So they really see that this is a huge impact on what's going on. Now, as you dig a little bit more into it and get, a little bit more to the nitty gritty, 91% of that 172 say that the rising cost of healthcare is having an impact on their competitiveness. So that can be part of that attract and retain, and also a number of other things, right? So if I'm paying more for my healthcare, then it may also be affecting other parts of my business. And a big one, if you're an employee out there, this is a big one. The costs are directly or indirectly crowding out salary and wage increases. So 73% say, hey, we're having trouble increasing salaries because of direct or indirect costs associated with healthcare. And here's the tough one, folks. 91% say the rising cost will cause more cost shifting to employees. 91%. We're going to have to shift more cost over to employees. Now, we're going to have a follow-up on that here in just a second, but I want to give you one more. This is a great report, by the way. You go out there and find it, National Alliance of Healthcare Purchaser Coalitions. It is a really good report. There's a lot of other information in there. I wish we could spend the next 45 minutes digging deep into this thing, but you can go out there and find it yourself. It's the Pulse of the Purchaser 2023 survey. So I'm sure if you go out there and Google it, you can find that. All right. So what they really looked at, though, is what do you think? They asked these employers, what do you believe is affecting the affordability? What costs are getting you that makes the affordability really tough? Number one was drug prices. 93% said drug prices were pushing this. Well, remember, we're not getting any help from the government, right? We just talked about that. PBM reform, that's being cut. So government's not helping there. You're going to have to go find another answer. We've got answers. Drug prices, though, 93% say that's the problem. High cost claims, 88% say that. My buddy Nelson Griswold would say, is your broker doing anything to help you control the frequency of your high cost claims, right? How about how often that you are having high cost claims? There are ways that you can put things into plans that affect both of those things. But here are the top two things: drug prices and high cost claims that can be affected by a very well-designed plan. And then, of course, number three is hospital prices. 83% say hospital prices, lack of transparency. No matter what the laws are out there, most hospitals are not following them to the letter of the law to provide you that information. So there is a lot going on in that. Obviously, these employers are seeing that. But to follow up on what's happening with pushing cost over to employees, very interesting numbers here. So in 2023, the average employer spent $17,393 for family coverage per employee. So your family coverage, the employer spent $17,393. That's an increase of 48% since 2013. Absolutely ridiculous. Absolutely ridiculous. However, the big number there is, even though we have so many people that are getting help from their employer, nearly half of Americans who have medical debt owe more than $2,500. 4 out of 10 at some point have been unable to afford rent, groceries, or utilities because of those medical bills. I can't eat because of my medical bills. I cannot get many other things that are just basic life needs because of my medical bills. So 86% of Americans have also delayed care. So 86% of Americans who have medical debt have delayed care because of the anticipated cost. Absolutely insane. And of course, medical debt still remains the leading cause of bankruptcy in the United States. So there's so much that needs to happen on this side of it, but there are many, many ways that this can be addressed. So, once again, I highly recommend that you reach out to me to learn some of the ways that we can address these things so we can head off some of these problems that are out there. All right, something that is happening today. A core provision of the Affordable Care Act is under fire. This is going to kind of the second round, but there are going to be arguments heard today about the Braidwood versus Becerra suit that is really looking at the preventative care provisions that are in the ACA and whether or not they are legal, whether or not they're constitutional. This was brought up because a group did not want to have to pay for HIV medications. They didn't want to be required to cover those medications because they felt it violated their rights under the Religious Freedom Restoration Act. And that actually was upheld. So they won their first round. It is now going to the Fifth Circuit of Appeals. It will most likely, regardless of what the outcome of this one is, it will most likely end up in the Supreme Court. The interesting part of this was they weren't actually going after all of the things in the preventative care. They were going after one part of it, but it all kind of got lumped in together because that is where this particular thing falls. It falls underneath the preventative services. Since it falls underneath the preventative services, that meant that the whole thing had to be really attacked, or the look of it had to be attacked. So it'd be interesting to see where it goes. We probably won't even get a ruling from the appeals court for a few weeks, if not a few months. And then once again, it'll most likely head to the Supreme Court regardless of what happens. So that is just something to keep on your radar. We'll, of course, keep you up to date as things go along. And then finally, United Healthcare, target of antitrust violations probe. If you don't know much about United Healthcare, they are the leading employer of physicians in this country. So there's more physicians that work for United Healthcare than any other entity. So I am not a huge fan of an insurance company owning a bunch of medical practices. That just really seems a little shady to me. There's a lot of other things they do. If you didn't know, the group called Change Healthcare that has been breached, they are actually owned by United Healthcare as well. So that is the number one clearinghouse for claims from other employers and, of course, pharmacies and medical practices. It's the number one place where all of these claims are processed, and it's owned by, if you're Blue Cross or you're Humana or whoever, it's actually owned by a competitor that actually has access to all that data. So it's kind of an interesting dynamic there. United Healthcare has been really growing leaps and bounds. They have their fingers in every single thing across the healthcare world except for hospitalization right now. And I'm doubt very seriously if they're not looking at that. There would be no reason why they wouldn't. But this probe is asking some very serious questions about the way that they have grown, and in particular of the way that that United Healthcare is designed, because of the way the ACA was was written. There is some limitations on how much an insurance company can make in profit. And because they own so much of the healthcare supply chain, whether it's the pharmacy benefits side of it, whether it's the physician groups, and really a bunch of other little parts of it, including now some home health, because they own other parts of this, the question is, if they're paying themselves through this process, then how can you limit what their profit is? So, think about that. If I'm actually paying myself, but I'm limiting how much this one can make, but there is no limit on some of the other ones and how much they can make, where is the real oversight in there? So I think that's one of the things that's really bringing this to the federal government's mind. Is it's been talked about so much how many fingers they have in the pie, as it were, that it's hard to determine where those lines are drawn and how well they're even drawing those lines. So I think that's an interesting thing to look at. Whenever United Healthcare first looked at buying Change, the Department of Justice actually kind of put a halt to that and said, this is maybe not a bad idea. There could be some antitrust here. Who knows what happened with that, right? It just kind of quietly went away and was allowed to happen. But now there's interest in looking at the operations of United Healthcare again. So once again, we'll see where this goes. We'll keep you updated as time goes by on what's happening with this particular probe. All right. So it is time for any Q&A that any of you folks may have. I appreciate the comments we've already got, but if you have any questions about any of these stories, please put them in the chat now. Any comments that you'd like to make, we'd also appreciate to hear those. We're going to keep that open for just a couple of minutes, and then we're going to go ahead and sign off. All right. Yep. Can't wait. Can't wait for the federal government to fix things. That's right. You got it. Thank you for that comment. Once again, it's great. Thanks for the comment, Greg. Appreciate that. And you know what? When there's options out there, Greg, right? We both know that there's options out there right now where you don't have to wait for the government. You can go ahead and start making those changes right now and stop being in a position where you're at the you're really waiting for the government to do something. So yeah, when you monetize bad stuff, you get more bad stuff. That's absolutely true. Yeah, if you want to make sure more bad stuff comes up, then just show people how to make a whole bunch of money with it, and then you'll be sure to absolutely get more of the same. That's a very good and honest and true comment right there. Absolutely. All right. Well, I hope you guys enjoyed the new format that we have here. We would absolutely love any comments that you have. So when this event is over, I'm pretty sure it will be posted across all of these different platforms. Please comment on it. Please let us know how you like this. Hey, quite honestly, we're just giving it a whirl, right? It seemed like a good idea when we decided to give it a shot. So if you like this, great. If you prefer something different, what we really want to do is just bring some excellent information to folks so that you can make your own choice on these things, but also stay up to date on what's going on with our industry. Once again, appreciate you being here today. Everyone have a super blessed week, and we'll catch you next week on the Kickstart.